What is the role of anticoagulation during cardiopulmonary bypass in non-cardiac surgeries? A. To prevent systemic hypertension. B. To prevent clot formation in the bypass circuit. C. To enhance tissue oxygenation. D. To increase blood viscosity during the procedure. Answer: B. To prevent clot formation in the bypass circuit. Explanation: Anticoagulation is crucial during CPB to prevent clot formation in the bypass circuit and to protect the patient from thromboembolic events. Heparin is commonly used to maintain adequate anticoagulation. Proper monitoring of the activated clotting time, ACT, is essential to ensure that anticoagulation is sufficient without causing excessive bleeding. Which of the following interventions is typically employed to mitigate the inflammatory response associated with cardiopulmonary bypass during non-cardiac surgery? A. Administration of corticosteroids. B. Administration of intravenous vitamin C. C. Lowering the temperature of the patient. D. Use of anticoagulants to prevent clot formation. Answer: A. Administration of corticosteroids. Explanation: Corticosteroids may be used during CPB to reduce the inflammatory response triggered by the bypass circuit. The use of corticosteroids has been shown to help modulate the systemic inflammatory response syndrome, SIRS, associated with CPB, though its effectiveness may vary. In addition, other strategies, such as minimizing the contact of blood with the artificial surface, can also help mitigate this response. Which of the following factors does not directly impact the success of cardiopulmonary bypass in non-cardiac surgeries? A. The patient's underlying lung function. B. The size and type of the bypass machine used. C. The duration of the bypass. D. The patient's level of consciousness during the procedure. Answer: D. The patient's level of consciousness during the procedure. Explanation: The level of consciousness of the patient is not a direct factor in the success of cardiopulmonary bypass. Key factors influencing the success of CPB include the patient's underlying lung and heart function, the type of bypass machine used, and the duration of the bypass. Anesthesia management is critical, but the patient's consciousness is not relevant during CPB since the patient is typically under general anesthesia. Which of the following is a common indication for using cardiopulmonary bypass in non-cardiac surgery? A. Open reduction of a fractured femur. B. Resection of a large mediastinal tumor. C. Carotid endarterectomy. D. Kidney transplantation. Answer: B. Resection of a large mediastinal tumor. Explanation: Resection of large mediastinal tumors can be a common indication for the use of CPB in non-cardiac surgeries. The tumor may be located near major blood vessels or the heart, requiring temporary cessation of heart or lung function to allow safe removal of the tumor. CPB enables circulatory support during such complex surgeries. Which of the following is the most critical aspect to monitor during the use of cardiopulmonary bypass in a non-cardiac procedure? A. Blood glucose levels. B. Oxygenation and ventilation. C. Electrolyte balance. D. Urine output. Answer: B. Oxygenation and ventilation. Explanation: Oxygenation and ventilation are the most critical parameters to monitor during CPB in non-cardiac surgery. Since CPB temporarily replaces the heart and lung function, ensuring adequate oxygenation and carbon dioxide removal is paramount. Blood gases and oxygen saturation should be regularly checked to ensure proper function of the bypass circuit. Which of the following strategies can help reduce the inflammatory response during cardiopulmonary bypass in non-cardiac surgeries? A. Use of high-flow oxygen. B. Administration of prostacyclin. C. Blood temperature lowering. D. Use of low-resistance cannulae in the bypass circuit. Answer: B. Administration of prostacyclin. Explanation: Prostacyclin is a vasodilator that can help reduce the inflammatory response triggered by cardiopulmonary bypass. It is often used to prevent platelet aggregation and smooth muscle contraction, which can contribute to systemic inflammation during CPB. While other methods, such as temperature control and low-resistance cannulae, are important, prostacyclin specifically targets inflammation. In non-cardiac surgeries utilizing cardiopulmonary bypass, Which of the following is the most common complication associated with the use of artificial surfaces in the bypass circuit? A. Hemolysis. B. Blood clot formation. C. Coagulation disorders. D. Air embolism. Answer: A. Hemolysis. Explanation: hemolysis, or the destruction of red blood cells, is a common complication due to the interaction between blood and the artificial surfaces of the bypass circuit. High shear forces in the circuit can cause mechanical damage to red blood cells, leading to hemolysis. Proper management of pump flow rates and anticoagulation is essential to minimize this risk. Which of the following is a potential long-term complication following cardiopulmonary bypass in non-cardiac surgeries? A. Chronic kidney disease. B. Impaired wound healing. C. Peripheral neuropathy. D. Cognitive dysfunction. Answer: D. Cognitive dysfunction. Explanation: cognitive dysfunction, often referred to as pump head, can be a long-term complication after cardiopulmonary bypass. This phenomenon is characterized by memory impairment, difficulty concentrating, and other cognitive disturbances, which can occur days to weeks after surgery. The cause is still debated but may involve microemboli, inflammatory responses, or metabolic changes during CPB. What is the purpose of using a retrograde cardiopulmonary bypass in certain non-cardiac surgeries? A. To reduce the risk of hemorrhage. B. To protect the kidneys by ensuring better renal perfusion. C. To allow easier surgical access to thoracic structures. D. To improve oxygenation by bypassing the lungs. Answer: B. To protect the kidneys by ensuring better renal perfusion. Explanation: retrograde cardiopulmonary bypass is used in certain situations to provide better renal perfusion. In this method, blood is returned to the body in reverse direction through venous cannulae, helping ensure that the kidneys receive adequate blood flow during the procedure, thus reducing the risk of acute renal injury, which can be a complication of CPB. Which of the following is typically required for weaning a patient from cardiopulmonary bypass in non-cardiac surgery? A. Monitoring of intraocular pressure. B. Gradual reduction in bypass flow rate. C. Administration of heparin to reduce clotting. D. Sudden reduction of anesthesia levels. Answer: B. Gradual reduction in bypass flow rate. Explanation: weaning a patient from cardiopulmonary bypass in non-cardiac surgery requires a gradual reduction in bypass flow rate, allowing the heart and lungs to resume their normal function. The process also includes careful monitoring of cardiovascular status to ensure stability, as abrupt changes could lead to hemodynamic instability. Reducing anesthesia levels or administering heparin is not directly related to the weaning process.